Well, next month is Mental Health Awareness Month, and we know how important it is to raise awareness, to reach out and have services available to families who need them. This morning, we want to tell you about a new program at Creekside Behavioral Health that reaches out to the teen population. Here with more now is Ryan Woodzell. And Ryan, great to have you on the show.
Thanks so much.
Well, certainly an important topic, especially after the year that we're coming off of.
Absolutely.
But really, at any point, let's talk a little bit about Creekside Behavioral Health. For somebody that may not be familiar, you guys opened your doors a couple of years ago, right?
Yeah, so we opened in October of 2018, and we are a 72-bed inpatient psychiatric hospital. We treat a range of populations from adolescents to geriatric to individuals who struggle with chemical dependency or acute mental health needs as well. So, you know, we've got all of those different units, and while the majority of what we're seeing right now is more of our inpatient populations, we've got some outpatient programs that are doing a really great job and are growing right now as well.
I was going to say, over those last couple of years, you guys have experienced a lot of growth, continuing to sort of meet the needs where they are in the community, and that really brings up this new program that you guys are doing. Yeah,
so it is our Adolescent Partial Hospitalization Program. So what it is it's 5 days a week. We're going to be rolling it out in June. 5 days a week, you know, Monday through Friday, from about 9 to 3. Which is going to be a great kind of middle ground because, you know, school will mostly be out over the summer. So it's a great opportunity to meet a lot of different needs. We're going to do a lot of group-based therapy. We're going to have some art therapists. We're going to have some specific time set aside in the program for school in case there is some school needs that need to be met. And then, of course, this fall, once school starts back, we're going to kind of continue the program and make sure that it's continuing to go even though the school year will still be going as well.
It sounds like you really implement it to be part of their life instead of taking over their life.
Absolutely. So, you know, traditionally what we see is people coming into the inpatient population and then stepping down to the partial hospitalizations or the intensive outpatient programs. However, people from the community can also come in and, you know, get assessed and see if maybe they are appropriate for some of our outpatient programs rather than having to come into the inpatient population.
So who would benefit more then from the outpatient programs and the types of services and programs?
Right, so that's a great question. So here in the Tri-Cities, we are fortunate to have a lot of different providers that range from individual psychiatrists or therapists all the way up to big corporations or agencies that provide a number of different services. But even though there's such a high supply, the demand is still even greater. So sometimes, you know, individuals aren't able to get therapy more than once a week or once a month or once every other week. So our programs are really appropriate for people that need more intensity for their therapy and their treatment to help maintain their stability once they're out in the community.
That's wonderful. What kinds of things are you seeing now when it comes to the adolescents that you guys are working with?
So, you know, right now we're seeing a lot of overwhelm with school, you know, because of such a transition with going all in school and then being off for months and then coming back and really not knowing how to handle such an overwhelming amount of schoolwork. We're also seeing a lot of like isolation due to COVID because, you know, kids are with their families or their older family members and they're not able to go and spend time with their friends or be at school or do things that give them that social aspect of their life that help them kind of maintain some stability.
That's wonderful. So you guys are there to help them sort of talk through it. I think for parents, you know, you try and you step in, but there are times when it's just too overwhelming for a parent to handle, and that's okay.
Right, and you know, I think there's this misconception that parents have to know what to say all the time, but there are a lot of times where, you know, we can step in and be the professionals and say, hey, it's okay to not be okay. We want to be that support, you know, for parents who are feeling overwhelmed, but for the kids that don't really know what they're feeling.
Yeah, great to have you guys doing great work. We'll look forward to continued conversations.
Thank you, thank you.
We'll give everybody the information. This new program again starting next month, and you can find out more by visiting their website. That's creeksidebh.com. You can also give them a call. They're right there in Kingsport.
Thanks so much.
The preceding portion of Daytime Tri-Cities was sponsored by